Good afternoon, everyone, and welcome to the SGM Health Talk organized by Soka Gakkai Malaysia. Before we begin, kindly take note of the following disclaimer. The information provided in this medical health talk is of a general nature and is not intended to be taken as a specific medical consultation. The contents herein are the speaker's view and do not constitute the position of Soka Gakkai Malaysia. Once again, a warm welcome to the SGM Health Talk. Our topic for today is It's the Heart That Matters. My name is Chien, and I will be your moderator for today. About the size of our fist, the heart is a small but powerful organ which pumps blood throughout our body. A heart attack occurs when the flow of blood to the heart is blocked. Being the leading cause of death in Malaysia, a heart attack is a frightening experience to those who have experienced it, as well as to those who have witnessed their loved ones experiencing it. Furthermore, with the COVID-19 pandemic that ushered in a new era of remote work and study for most people, it becomes easier to accumulate a high portion of sedentary behaviors, which can be a risk factor for heart attack. Today, we are honored to have with us two distinguished speakers, Dr. Xiao Yun Ki and staff nurse Tong Si Hao, who will be speaking to us on the delicate matter of our heart. Dr. Xiao graduated from Crimean State Medical University in Ukraine. Subsequently, he obtained his master's from the Royal College of Physicians in the United Kingdom. He is currently pursuing his fellowship in cardiology and working in the cardiology department of Serdang Hospital. Let us put our hands together for Dr. Xiao.
Thank you so much, Chien. Good afternoon, everybody. Welcome everyone to join us online on this pleasant Saturday afternoon. Without further ado, let us get started. In the next 20 minutes, let us explore the details of ischemic heart disease. Today's outline will mainly focus on what is ischemic heart disease and heart attack, its symptoms, investigations, treatment, who is at risk, or we call high-risk group, myth, and prevention. According to the Department of Statistics of Malaysia, the report in 2020 showed that ischemic heart disease is in the top of the list of the 10 principal causes of death in the year of 2020. It was about 17%. In the same report, also showed that ischemic heart disease remained one of the common causes of death for those more than 40 years old. So now, let us explore what exactly ischemic heart disease is. Ischemic heart disease, also called coronary artery disease, is a heart problem caused by narrowed heart arteries. When arteries are narrow, less blood and oxygen reach the heart muscle. Due to a narrowed vessel, it ultimately leads to heart attack. It might be pretty tough to imagine what I'm trying to explain, especially the heart vessel or coronary artery. So let us look at the next slide. As you can see from the slide, there are few crucial components to make up the heart. They include large vessels. As you can see on the left-hand side, on the top, there will be a blue color vessels and red color vessels. And on the right-hand side, there are smaller vessels on the lower bottom, or lower right bottom. Besides the arteries and big vessels and small vessels, there are also valves and heart muscles. So the large vessel is called aorta, while the smaller vessels covering the heart muscles are called coronary arteries. These arteries carry oxygen to the heart muscle, and they are the focus of our talk today. For the heart to pump normally, coronary arteries play an important role. Supplying oxygen It's as though supply food to the heart muscle. In the ischemic heart disease patient, they might experience chest discomfort or chest pain due to narrow coronary arteries. It is due to a narrow vessel being unable to supply enough oxygen. Thus, the demand and supply discrepancy will eventually cause the patient to have symptoms. You might be wondering why narrow vessel causes chest pain. Let us imagine that the blocked blood vessel will have lesser blood supply to the heart, like when we are hungry but getting not enough food. So eventually we will have stomach ache or gastric pain. Let us look at another example. On the screen, you can see when we are young, the vessel is smooth, blood supply is good to cope with the demand, and we shouldn't feel any chest pain or any symptoms. Perhaps after 20 years old or 30 years old, we start to smoke, have good food, and even an unhealthy diet, have stressful life and so on. The vessel will begin to have some plaque and become narrow. And that is where the lesser blood supply will be taken place. This condition will cause certain degree of chest discomfort or pain. If the blockage becomes more and more serious and severe, eventually the blood flow is severely compromised and they will experience severe chest pain and even heart attack. So now let us look at one of my patients, Mr. Alex. So Mr. Alex is a 60 years old gentleman. He smokes regularly. He also has diabetes, high blood pressure, high cholesterol level. So he experienced chest pain and tummy pain since 10 o'clock in the morning today. So if we are looking back retrospectively, now it's almost 6 hours ago. So my question is, if you are Mr. Alex, or if you are Mr. Alex's family members, what will be your next step? We have four choices today. So your next step, number one, you can take as to take gastric medicine. Number two, to apply wind oil medicine, we commonly call 風油. So number three, to take rest and observe. And number four, to see doctor. So in this case, no matter Mr. Alex has contracted ischemic heart disease or not, or even heart attack, my suggestion is to see the doctor as soon as possible. So the longer that Mr. Alex waits, the more heart muscle will be damaged and the worse the outcome. So we do not know whether Mr. Alex really have ischemic heart disease or not. But in case this is a real heart attack, 6 hours waiting time is a bit too long to wait, all right? So remember, time is muscle. So if you or your loved one experience the above symptoms, please see your doctor as soon as possible. So besides chest pain or discomfort, ischemic heart disease patient might also experience pain or discomfort in the arms, left shoulder, elbows, jaw, or back. The next slide will tell you ischemic heart disease patient might also experience difficulty in breathing, nausea or vomiting, lightheadedness or giddiness, experience cold sweat, or becoming pale. So if you have any of the above symptoms, please remember to go and see your doctor as soon as possible. So next, once your doctor sees you and suspect that you might have ischemic heart disease, they will do a physical examination, the doctor will listen to your lungs, to your heart, etc. Afterwards, the doctor will order some tests, including ECG, which is known as heart tracing, X-ray, and sometimes even some blood tests. So besides the basic tests, the doctor might also order some additional tests, including echocardiography, which is the ultrasound scan of our heart, stress test, which means you will be subjected to running on the treadmill, and the doctor will be monitoring your heart tracing. So next, other tests like includes a CT scan or MRI of the heart. So lastly, your doctor may offer to do an angiogram. So what is coronary angiogram? So an angiogram is a procedure that assesses the patency of the coronary arteries. By putting in a long tube from the forearm or the groin, the doctor can determine how bad the blockage of the heart arteries, what we call coronary arteries. Of course, the doctor will order the test accordingly. Each test has its benefit and risk. So it is crucial to discuss with your doctor the best modality of investigation. You might check online for more details or listen to those experiences of those done before. But anyway, the most important thing to do is to consult and discuss with your treating doctor if you have any doubts before proceeding with the treatment strategy and decision. Next, if you are diagnosed with ischemic heart disease, depending on the severity of the disease, the treatment plans include: number one, the treat with medicine only, or number two, angioplasty, or we commonly known as putting in a balloon or stent, or in Cantonese we call tong po zai. So for certain degree of blockages, the doctor decide to treat with balloon or stent to keep the patency of the coronary arteries. So the third option of treatment would be surgery. If the disease is too severe and extensive, your doctor might suggest proceeding with bypass surgery. So again, each treatment modality has its benefit and risk. So always discuss with your treating doctor and find out the best treatment strategy. So next, I would like to draw your attention. If you have the risk shown on the screen, you might be the high-risk group, and please take extra precaution. The high-risk group includes those more than 40 years and above, obesity, male in gender, diabetes, hypertension or high blood pressure, high cholesterol level, chronic kidney disease, and those with regular dialysis, family history of high cholesterol, family history of ischemic heart disease, or family history of sudden death. If you have the above risk, please schedule a regular medical checkup if you are at risk, and see your doctor immediately if you experience chest pain, difficulty in breathing, etc. Remember, time is muscle. Okay, so now I have prepared 3 questions and answers to explore some myth today. Let us look at the first myth. As we all know, tobacco smoking is bad to us and also increase the risk of getting ischemic heart disease or heart attack. So some of us might hear that vape is a safer alternative to quit smoking. Is that true? It is not true. So in Malaysia, I will explain furthermore. So in Malaysia, more than 1 million people are electronic cigarette consumers. So more frightening is the majority of them are adolescents, ranging from 10 to 19 years old. As you can imagine, 10 years old to 12 years old, they are primary school students. So this is something very worrying and something very frightening. Yeah. So as we all know, commonly heard that electronic cigarettes are safer and contain lesser harmful substance. Is that true? I would say it is not. Electronic cigarettes still contain nicotine, and it will rapidly increase the heart rate and blood pressure after consumption, and which subsequently increases the risk of heart attack. And next, I would like to draw your attention again that nicotine will reduce the brain development in adolescents. So on the other hand, electronic cigarettes also can damage the lungs and cause chronic lung diseases and even cancer. Besides nicotine, electronic cigarettes also contain up to 15 harmful substances in a long-term use, causing damage to different organs, including damage to the brain, lungs, kidney, liver, eyes, stomach, and so on, and eventually will increasing the risk of developing cancer of all these organs. So the electronic cigarette is not safe as publicized, and definitely is not an alternative to use as a tool to stop tobacco smoking. Okay, next, let us explore the second myth. Medicine will damage kidney and liver function. So some of the patient will decide, or some of our family members will decide to take the medicine in alternate days or take once a week. Is that okay? So the answer is no. Okay, it's not okay. So if you are being diagnosed with ischemic heart disease, please strictly follow the doctor's advice and take medicine regularly. Of course, regular blood tests and checkups are also important. Suppose the doctor put in stent or balloon to your vessels and you take medicine in alternate days, there will be in this way, it will putting you a very high risk of getting the treated vessels to develop blockage again and eventually causing heart attack again. The same goes for those after bypass surgery. Medicine is relatively safe to be consumed, so your doctor definitely gives you the best combination of treatment. If you experience any side effects after taking medicine, please highlight this problem to your treating doctor. It is essential to discuss before you decide to change the dose or even stop the medicine with your treating doctor. So now, let us come to the third question. It's about sudden death. Sudden death means a healthy individual, especially young people, pass away out of sudden. We always blame it on heart attack. However, there are many possibilities of sudden death. First, almost half of the sudden death patients die due to heart disease. But I would like to highlight that those heart disease not only include ischemic heart disease, but also it might be due to disease of large vessels, disease of heart muscles as well. So next, the cause of sudden death, it might be due to brain hemorrhage or the bleeding in the brain, also very common causing sudden death. That's all for the 3 questions and answer for today. If you still have any questions, please see your doctor and consult your doctor. Lastly, prevention is always better than cure. Please quit smoking, no matter you are consuming conventional tobacco or electronic cigarette, since it causes damages to different organs and risk of developing cancer. Next, 1 to 2 hours per week will be ideal to have regular exercise. We can go back to the previous slide. Healthy diet and lifestyle are also important. So next, regular medical checkups are also crucial, especially for those high-risk groups that I mentioned just now. If a doctor gives you medicine to control risk factors like diabetes, hypertension, or high cholesterol, or to treat ischemic heart disease, remember, follow your doctor's instructions. I hope all of you stay safe and stay healthy. It is the heart that matters. Time is muscle. That's all for my sharing today. Thank you so much. Back to you, Chien.
Thank you, Dr. Xiao, for that enlightening and informative session on heart attack, as well as the debunking of some common myths on heart attack. We often hear of the intensive care unit, ICU, but not much of the CCU. In the next session, we have Chong Si Hao, who will be speaking to us on the CCU. Sihao obtained his diploma in nursing and is currently working as a nurse in the CCU at the Kuala Lumpur General Hospital. Without further ado, let us welcome Sihao.
Okay, thank you, Xian, for your kind introduction. Good afternoon, everyone. I am Sihao. I am a nurse currently working in the CCU department of the Kuala Lumpur General Hospital. I have been in this field for 17 years. Of the Kuala Lumpur General Hospital, then I wanted to have more nursing knowledge and experience. So after about 3 years, I was transferred to the CCU. I have been working there until today. The work in the CCU is more challenging. This is because we have to take care of patients with heart disease and ventilator patients. When a patient with severe heart disease encounter danger such as low blood pressure, low oxygen level, cardiac arrest, and so on, the entire team needs to take emergency measures to save or resuscitate the patient, like monitor the ECG, giving medicine, performing CPR, giving anesthesia and intubation, and others. After performing a series of resuscitation, we would then have successfully saved the patient. Today, I would like to share about the CCU. What is CCU? Does it stand for Critical Care Unit, or is it Cardiac Care Unit? So, CCU is Coronary Care Unit. There were many times when we talk to a patient or their family members about CCU admission, most of them are not able to tell the difference. Their first thought is usually, is it the ICU? They think that, is it going to be serious, and is the patient going to be intubated or put on a ventilator? So sometimes I will explain to the patient family members that the CCU is the intensive care unit for heart disease patients. In the CCU, there is a need to monitor the heart rhythm closely. However, most of the patients will not be sedated or intubated. It's just like a normal hospitalization, and the patient just needs complete rest in bed. Have you wondered, when did the CCU start? Before the era of the CCU, some patients with heart diseases were not closely monitored in the normal ward, or they are needed to wait until there were ICU beds available. Hence, when a patient encounters chest pain or heart discomfort, this may not have been detected on time, and they miss the timely and the right treatment. As early as 1960s, the CCU was slowly developed, starting from the United Kingdom, Australia, and the United States. The CCU is now available in hospitals all over the world since the CCU was established. With more cardiac specialists and better intensive care, it improved the outcomes of heart disease patients as well as reduced mortality. In fact, the CCU is a type of specialized intensive care unit. The first C is the short form of coronary, and it is specialized designed for severe coronary artery disease. The second C is care, and the U is unit. So CCU is the short form of the coronary care unit. So next, what is the difference between CCU and ICU? The answer is, both of the units are used to treat very ill patients. ICU is to provide treatment for very ill patients, for example, intubated patients or patients after major surgery, and so on. However, the CCU mainly focus on patients with heart disease. As we all know, the heart is the important organ. I would like to emphasize that not all heart disease patients need to be intubated or using a breathing machine, but certain heart disease patients need to be admitted to the CCU for cross monitoring. The ICU and CCU are taking care of different types of patients. Having CCU also treating other types of patients, for example, patients who need urgent dialysis. Although these two units are different in terms of patient care, but they serve the same purpose. That is to save the life-threatening patient. Next, what kind of patient does the CCU needs to take care of? Who can be admitted to the CCU? As Dr. Xiao shared just now, if the patient condition becomes serious or needs to be treated, he will have to be admitted to the CCU for cross monitoring. Some patients who are intubated and ventilated were also admitted to the CCU. This includes cases with heart attack and coronary artery disease, acute pulmonary edema, irregular heartbeats, etc. After admission, we will monitor the patient's ECG, blood pressure, oxygen saturation, and so on. They need complete rest in bed, and hence all their activities will be restricted. During admission, the doctors and the nurses will assist the patient with their daily needs, such as passing water and motions, giving medicines, blood tests, etc. Patients need to rest in a quiet environment, and the lights in the room will be dimmed occasionally. The CCU and ICU are clean and sterile rooms. Visitation times is limited. In this way, patient will get enough rest, and the medical staff will have more attention to treating patients. Once the patient condition improves, he will be sent to a normal ward or discharged. Patients need to take care of their own hearts. After being discharged from the hospital, they have to take their medicine regularly, follow up regularly, observe healthy diet, do light activities, exercise regularly, but avoid extreme exercise. Please stop smoking and stop consuming alcohol, and reduce stress and live a happy life every day. Soka Gakkai President Mr. Ikeda once mentioned, leading a well-balanced life, do not overeat, getting enough sleep and exercise are all vital. Okay, everyone, let's take good care of our own health. That's all my sharing today. I hope everyone has enhanced their understanding about the CCU and its importance. Thank you.
Thank you, Sihao, for sharing your valuable insights on the CCU with us. It must be an intense experience to work in the CCU, and there's no better way for us to gain an understanding of this unit than through Sihao's first-hand account. Thank you again. Let us give another big virtual round of applause to our wonderful speakers for today, Dr. Xiao and Sihao. Before we end our session today, let us invite Dr. Xiao again to deliver his conclusion. Over to you, Dr. Xiao.
Thank you so much, Sihao and Chien. So to conclude today's health talk, I've prepared 3 questions. So let us look at the first question. Medical science treat illnesses, so why do we need prayer? SGI President Ikeda mentioned that medical science objectively analyzes the cause of illness and treat them based on what it finds. In contrast, prayers elevate the state of our life and revitalize us spiritually. A wise man once said, "More valuable than treasures in a storehouse are the treasures of the body." And the treasures of the heart are the most valuable of all. So what are the treasures of the storehouse, body, and heart? The treasures in the storehouse refers to money and material. Treasures in the storehouse refer to money and material wealth, while treasures of the body are the physical body, health, and our physical skills, while the treasures of the heart resemble brilliance and the richness of our character and humanity that we built within our lives. It only can acquire through prayers. So let me give you an example. What are these three kinds of treasures like? For example, for instance, an artist. So his income and his properties like house and sports car are considered treasures in the storehouse, while his performing skills, his health condition, and even good or handsome looking are considered treasures of body. But the treasures of the body are not eternal. We may fall ill or sick one day, no matter what. On the other hand, we can have a strong, healthy body at the moment, but if our mind is filled with insecurity and fear, our lives will still be very unhappy. So I would like to draw your attention that treasures in the storehouse and treasures of the body are equally important in the modern days. Having said that, both the treasures do not guarantee our happiness. SGI President Ikeda also emphasized that genuine happiness is not determined neither by how much money or properties that we have, nor how good our skills in our profession, but the genuine happiness is determined by the inner strength and the richness of our heart. If our heart are burning with hope and courage at all times and filled with the spirit to challenge, we will be brimming with joy no matter what our situation. This is true happiness. Okay, now let us look at the second question. As I mentioned just now, prayers are important. So if we fall sick, is it okay that we do not see doctor, but only pray to get well? So the answer is no, yeah? As SGI President Ikeda once said, you cannot treat illness through prayers without going to see the doctor. But you must seek medical attention as soon as possible. Follow the doctor's instructions and work hard to take care of your health. Of course, praying is important. As we rest and recover from illness, we will be able to recover our strength very soon so that our family members will not worry on us. Lastly, the third question. To cope with a heavy workload in school or at workplace, so we can only sacrifice the time to sleep or time to rest. Is that right? So the answer is a lack of sleep or enough rest is the root cause of developing diseases. So it will be trouble our family members or even friends if we are sick or we met any accident. Thus, having proper rest and enough sleep is crucial to maintain our health. On the other hand, many people go about their days absent-mindedly or working in a half-hearted manner. But it is better to live with the spirit that now may be the last moment of our life and consistently do our best to get things done as quickly as possible. Mornings are especially important. If our life condition is strong, we will take action that creates value and develop the wisdom to increase our efficiency. Lastly, please avoid watching television or watching smartphones into the late hours of night or keeping late hours generally. In addition, I hope all of us will avoid excessive drinking and smoking as well as eating late at night. We are the one responsible for looking after our own health. Please take care of yourself so that you can fulfill your personal mission wholeheartedly. That's all for my sharing today. Thank you very much. Back to you, Chien.
Thank you, Dr. Xiao, for that encouraging conclusion. Ladies and gentlemen, we have come to the end of our health talk. Thank you for your attendance. We hope that this talk has been beneficial to all of you. Please take care and stay safe. Bye-bye.